Hi, my name is Mahalit, and today I'll be doing an oral medication administration video. And I have all my medication here. The first thing I do is I'm gonna go ahead and verify the provider doctor's order, and after that I'll verify the 6 rights of medication administration, which excuse me, which are like right patient, right drug, right dose, and right time, and the right documentation. And now I'm gonna go and check this medication order, like the order I have in hand, and then I'm gonna go to the MAR and check and get them ready for my patient to administer. And these are the medication that are listed. And if there is any medication that needs to be calculated, I would do that before going to my patient's room. And these are the medication I have. So I'm going to introduce myself to the patient. Hi, my name is Mahalit, and I'll be your nurse today. And going to identify the patient using 2 identifiers. I'm going to have the patient say the name. And at the same time the patient saying the name, I'm going to go ahead and identify the name on their wristband. And of course I should provide a privacy to my patients. And then I'm going to have a hand hygiene, and then wear my gloves. So I'm going to go ahead and wash my hands and wear the gloves. And I'm gonna ask my patient if they have any known allergies, and then if the patient doesn't have any allergies, I'm gonna go and compare the name and the name of the patient, the name of the medication, compare it with the patient's the name of the patient, compare it to the MAR. So that will be my 3rd check, and I have all the medications here, as you can see. And for the first order, I have Lotensin. This used to treat a high blood pressure. It will help us like lowering the high blood pressure, and I would check the blood pressure before administering the medication to the patient. And the side effects for this medication can be dizziness, lightheaded, or a headache. And the adverse effect is just like swelling on the face, legs, tongues. And I'm gonna put it in my cup. And then the next medication I have is Keflex. This used to treat a variety of bacterial infection and prevent or works by stopping a growth of bacteria. And this is my medication. I'm gonna open it, and this side effects are like diarrhea, nausea, vomiting, and stomach upset. And it has an adverse effect of like a large like hive swelling on the face, tongue, throat, and hands. And I'm gonna go ahead and put it in my cup. And the third medication I have is a potassium chloride. This is like a medication, is a mineral supplement to prevent a low amount of potassium in the body. Potassium helps the cells, the heart, the muscles, kidneys to work properly. And before administering this medication, I would check the potassium level of my patients. Side effects can be upset stomach, nausea, vomiting, and adverse effect can be like vomiting, like a coffee ground, vomit, and like a very like a severe stomach and abdominal pain. Okay, and I'm gonna put my medication here. And the 4th medication I have is Pervusade. You can see it. Oh, this is used to treat certain stomach and like esophagus problems, such as like acid reflux, ulcers, and works by decreasing the amount of the acid your stomach makes, and it relieves the symptoms like for heartburn, difficulty swallowing, and stuff. I'm gonna put it on my cup. And the adverse effect for that medication is it can really cause like a severe intestinal condition due to a bacteria called C. diff or C. difficile. And the last medication not actually the last, I have is the zolpidem. As you can see, this used to treat insomnia, people that have difficulty sleeping. This is recommended. What I would monitor for this is like a monitor for impaired cognitive or motor performance, confusion of the patient, because as the patient is confused, they might like their potential for falling. So I would monitor for that before administering the medication. The side effects are like will impair your thinking or reactions. An adverse effect will be like you're gonna be like hallucinating and sensory distortion and sleepwalking are the adverse effects. And I'm gonna put my medication in my cup. That's all the medication I have for like tablets and capsule. And then I have acetaminophen, which is called Tylenol. I have the order 500 milligram per 15 milliliter, as you can see. Perfect. And for this liquid medication, I'm just gonna put it. What I do is I make sure it's truly mixed before administration, and I'll make sure I'm giving the right amount. If I need to do any calculation that I need to do, I have to do it ahead. And then I'm gonna go ahead and open it and make sure I put this, like the cap lid upside down, just for infection control. And I'm gonna grab this and pour it, like don't pour it holding the cup like this, just make sure it's on like a surface that it's like level surface. It like you don't have to be holding it like this, so make sure that the surface is level. And I'm gonna pour the dosage that was given, and let's do this. And then this is the two medication I have. Let me see if you can see it. And then after, let me show you. After I did that, I make sure I wipe this and the neck of the bottle, and then close it back again. Alright. And let me show you again. Yes, so these are my medications, and this is my the Tylenol I have. And the Tylenol is given for a pain, to treat mild to severe pain. The side effects can be like vomiting, nausea, like itching or loss of appetite. Excess, like taking an overdose of like the adverse effect is like if we overdose of Tylenol, it can damage the liver and cause to death. So this is the medication I have. While administering the medication, make sure I ask if my patient have any questions. I make sure I give him time to ask questions for the patient in order to like give them time to ask a question. In order to answer like their question, you gotta give them time. And then after that, I would putting them in a comfortable position is very important too. If they want to sitting up position or side lying, whichever they prefer, and then ask them how they prefer to take their medication. Do they like it with water? Do they like it with something else, that like applesauce? So give them an option how they would like to take it. And then I'm gonna take off my gloves. Proper way, I'm sorry, to take the glove, and so trash my gloves and wash my hands. And the last thing I wanted to do is a write of documentation. I make sure I document the medication I administer and a patient's reaction after administering the medication, and I have to go back and 15 to 30 minutes and assess for any side effects, assess for any adverse effect that the patient may occur. So it's always good to go back and check with the patient to see if they have any side effects, or if they have the allergies that they never had before, they don't know, you know. So it's always very important and necessary to go back and check to your patients and do your right documentation, and ask if the patient has any question after administering the medication, and make sure you undo your privacy, and make sure you ask them if they're in a comfortable position, if they need water or if they need anything. And the last thing you do is wash their hands and then leave the room and do your documentation. Thank you very much.